My name is Mary Turner. I'm president of Minnesota Nurses Association and ICU nurse at North Memorial Medical Center in Robbinsdale, Minnesota. The nurses of Minnesota have spoken. Yesterday, Minnesota nurses came out in strong force of show to call hospital executives to account for the crisis of care and the tension that they have created in our hospitals. Our hospitals are understaffed, overcrowded, nurses are overworked, and patients are paying the price, waiting longer for care and suffering more adverse events while still being charged sky-high prices for health care. Our CEOs have created these problems while taking home massive raises, and this is unacceptable. These problems existed before the pandemic, and today it's only getting worse. The future of healthcare depends on the choices that our hospital executives will make in the near future. Yesterday, we sent a clear message to these executives. Enough is enough. It is time to put patient care at the bedside before the bottom line. If our CEOs won't do it, we will. That is why 15,000 nurses in the Twin Cities and the Twin Ports have voted to authorize a strike. Because we need action now to address the chronic understaffing. We need action now to address the crisis of retention. And we need action now to protect the quality of care our patients expect and deserve in this wonderful state of Minnesota. Now make no mistake, we don't do this lightly. We all want to be at the bedside. We want to be there caring for our patients. But we are serious about addressing the crisis patients and nurses are facing at the bedside. Just this past weekend, every shift at North Memorial was 11 to 12 nurses down. And when I checked with all the other hospitals in the system, it was the same story. This is becoming the norm, and this is unacceptable. We've been negotiating for 5 months despite little movement from the hospital executives. That's why we've been working without a contract since June. And that is why we've taken this strike vote. We have been forced to do this because we've tried through legislation, we've tried at the bargaining table, and nothing is working. We don't do this lightly. This is not what we're called to do, but this is what we have to do. We're not calling for an immediate strike today, but with this vote, our nurses are giving our negotiating leaders the ability to call a strike. We're ready to fight. We're ready to put patients before profits. What happens next is up to the CEOs. Thank you, and now I'd like to call on a few nurses behind me that can tell you exactly why we voted to strike. I call up Brianna Nath from North Memorial.
Hello, my name is Brianna Nath. I'm a medical ICU nurse at North Memorial Health Hospital. I have worked my entire 15-year career at North. This is my 5th contract and my 2nd strike vote. Nurses do not take going on strike lightly. We want to be in our hospitals taking care of our patients, not walking a picket line. But enough is enough. We cannot continue to be treated the way we have been by our employers any longer. There is a saying by the nurses at North, a nurse is a nurse is a nurse. This is how nurses at the bedside have been thought of and treated by upper management, leadership, and board members for as long as I can remember. There is no value placed on our years of service, our specialties, or our expertise. North has a large portion of our staff doing rotating shifts at 50%, meaning one may work overnight one day, then within 24 hours be back to day shift. To North, we are just nurses. They do not value us as mothers, fathers, family members, or people. There are many studies related to shift work and the detriment it causes those that do it. When our negotiating team brought forward these concerns, and asked for a decreased ratio of rotating percentages, we were met with a stone wall. This is just one of many examples of how little our employer truly cares about its nurses, and one of many reasons I voted yes to authorize a strike. Nurses at the bedside that endured the COVID-19 pandemic have been forever changed by it. We were begged to work extra and put ourselves in harm's way for months while using the same N95 mask for as many as 10 shifts before we were granted a new one. We were the ones in patients' rooms, especially in those early days when managers, directors, and other various leaders were working from home. Our profession has suffered a huge blow in the last 2 years. We have been through hell and back, and we will not stop fighting until we are given a good and fair contract, a contract that we deserve. Not just for all we've endured over the last 2 years, but for all we've endured before that. Working short-staffed, rotating shifts at an unlivable pace, being verbally and sometimes physically abused by our patients and their family members, being constantly asked to do more and more with less and less. Again, enough is enough. We are a union built of strong nurses, nurses willing to do what it takes, nurses that are willing to go on strike in order to force the hospitals back to the bargaining table to actually make some progress instead of stonewalling every new proposal we offer. I, along with almost 15,000 nurses across the Metro and Duluth, are ready to do what it takes. We deserve more, and we are strong enough to get it. Thank you. And now we have Katie Donner from Healtheast.
Hi, my name is Katie Donner. I work at St. John's Hospital and have been there for over a decade. Last Thursday, Fairview management came to our negotiating session with nothing. In fact, management came down to tell us at 9:03 to say that they had nothing for us for the entire day. No new proposals, nor any counter to any of our proposals. They are clearly trying to get a stalemate. They are not working collaboratively to try to get a contract done. We do not take the decision to strike lightly. Throughout negotiations, Fairview has shown us that they do not value nurses, nor understand the situation that they have created through poor management decisions. We also believe Fairview has violated the National Labor Relations Act and committed unfair labor practices by demonstrating bad faith bargaining, interfering with union activity at work, and unilaterally changing our terms and conditions of employment. We reserve our right to hold Fairview accountable through an unfair labor practice strike. We demand safety for our patients, for our coworkers, and for ourselves. The next speaker is Jamie Wicklund from Children's.
Hi, I'm Jamie Wicklund. I'm at Children's in St. Paul. I've been there for 23 years. This strike vote happened because of many of the unresolved issues we have with our safe staffing. Other proposals on the table that look at retention and recruiting our nurses. These main issues need to be resolved before we can actually move forward in rebuilding this workforce that we are so proud of. Safe staffing is having the appropriate number of skill-specific nurses available at all times across the continuum of care. We are not able to do that. Our patient ratios are too high. We do not have enough resources in the hospital. When we come to the table to talk to Children's about safe staffing and what it means, they told us they're not interested in our staffing proposal. We should trust the hospital processes that they've placed for us for those staffing needs. They also told us that they are not interested in having our professional judgment be involved in staffing our workplace. We're looking at retaining nurses. How do you retain nurses? Children's lost over 500 of 1,500 nurses in the last 3 years. This started when we did have a furlough, but Children's didn't return those nurses to work as they promised them. This started the kind of spiral where people were leaving and they weren't coming back. The hospital's been hiring nurses, but we're seeing them not complete orientation. If they do complete orientation, they actually leave within a couple months because of the internal environment they've created with the unsafe staffing. Those nurses don't have enough resources for them to continue this career. The employees there don't want to work in the current culture that Children's has provided. We're looking at trying to recruit and bring on more nurses. It takes time. It takes 4 to 8 months to get nurses trained, depending on what specialty area you are in. They've made it very clear they're not interested in our proposals on the table. They're interested in just wages. They like to talk a lot about wages. We want to talk about safe staffing. We want to look at retaining our nurses, recruiting our nurses. We also want to talk about safety. There's many, many safety situations that we've heard. It's been in the news, in the media. All the hospitals are experiencing it. It took us, I think, 8 sessions, if I remember, just to get through a safety proposal in the beginning of negotiations with children. They kept saying it was important. If it's important, it shouldn't take 8 sessions over a period of 2.5 months. Children's recently issued a memo to the whole hospital, and it said that the nurses have a choice to make around the vote. The nurses at Children's made that choice. They choose to fight for the issues around safe staffing, retaining, recruiting our nurses, safety in the workplace. We need adequate resources and a safe environment for our patients and for our families. We need all of this to retain the nurses we have, to get more nurses to come to the bedside, to provide exceptional care to you and those you love. This is what we are proud of. Thank you. Angela Bicchetti from Alina.
I'm Angela Bicchetti. I'm a nurse at Abbott Northwestern and part of the negotiating team. Yesterday, 15,000 nurses in Metro and Twin Ports voted to authorize a strike. While this is not an easy decision, our hospital executives have left us no choice. There has been a theme at the bargaining table over the last few months. My employer Specialty's common answer to the nurses is not interested. Well, let me tell you what they aren't interested in. Workplace violence protection. Alina isn't interested in having staff security at all entrances in the hospital, or even a modern day technology such as sending a text to all employees of an immediately alert to staff to stay clear of certain areas when a violent event occurs. Especially after our coworkers, patients, and family have been assaulted, carjacking, attempted robbery, even in broad daylight in recent months and days. Violence on the nurses and other healthcare workers occurs on a daily basis. And Alina's response to the nurses at the table was, keep your wits about yourself. Staffing. Nurses are leaving the bedside. We are doing more with less resources. While Alina says staffing is a we problem, they refuse to discuss, negotiate, or even counter-propose on the issue. Your loved one is sitting in the ER room for 5+ hours, waiting to be seen. A nurse somewhere has to make a decision between giving a pain medication or giving comfort to a nurse or to a patient who just received life-threatening news. That void that the public is feeling is short staffing. Nurses are leaving work in tears because the shift they had just worked was short-staffed, and their manager's response is, sorry, I can't come in today. Based off a recent Minnesota Department of Health report, it showed an increase in adverse events for Minnesota patients as a result of overwork and understaffing. We are the nursing professionals, and we know what is best for our patients. But you keep saying, not interested. As you can see, Alina other employers, not interested is unacceptable. Now is the time for hospital executives and CEOs to be held accountable and fix the problems they created and continue to ignore. They have ignored our voices and our patients. We are putting patients before profits and will do whatever it takes to protect our patients, our coworkers, and our profession. I would like to welcome Caitlin from Methodist.
Here with me is a journal I kept throughout the pandemic of my most traumatic stories. I stand here today to honor those that we lost and to demand better for those that are still here. My name is Caitlin, and I'm a nurse at Methodist Hospital on the medical, COVID, and orthopedic unit. The core of all nurses' requests at the bargaining table comes down to better staffing, which is done by keeping nurses at the bedside. When nurses are treated well, given basic benefits, and compensated for their incredible work, they stay. When nurses aren't given enough resources to keep a patient safe, clean, and cared for, they leave. We've watched as nearly 1/3 of my coworkers, feeling burned out and traumatized, have left. Without adequate staffing to do our jobs, every day for the last few months has been a challenge. Working 12 hours straight without a break is a common occurrence. We've been drowning, and patients are the ones who suffer the consequences. We need the hospital to provide us with resources necessary to provide basic humane care. We've seen a large increase in bed sores because we don't have the staff to help patients move. We don't even have the staff to ensure someone gets their teeth brushed daily. It truly feels worse than even at the height of the pandemic. Rather than providing us with the fundamental resources we need to ensure you and your loved ones get the care you deserve, the hospital is choosing to prolong negotiations. Conditions in our hospital are not at risk of being compromised, they're already being compromised, and have been for a long time. Health Partners is well aware of this reality. While there is no be-all, end-all to improving our healthcare system, a huge step forward would be listening to and caring for the people who spend the most time in direct patient contact. We are asking for one of the most successful healthcare companies in the United States to put its head and heart together to help our patients, coworkers, and ourselves. Thank you for your time.
Yes. Our last person is Tracy Ducksworth from Fairview. Welcome.
Hello, everybody. I'm Tracy Ducksworth. I am a nurse in the Behavioral Health Department at M Health Fairview Riverside. Just coming here just to let you guys know a little bit about what's going on in our hospitals today. As a mental health nurse, our nurses today are facing a mental health crisis, which is affecting safety. It's affecting patient safety as well as nurse safety. Our staffing numbers are dwindling. Nurses are leaving the bedside. Fairview is telling us that they're looking for nurses. There's a shortage of nurses. No nurses are leaving the bedside. I can tell you, in the height of the pandemic, I have witnessed multiple coworkers assaulted by patients, verbally assaulted by patients and families, with no help or support from our hospitals. We are asking for safety measures from our hospitals. They are telling us it costs too much. We are asking for staffing. They are telling us it costs too much. They are giving us bonuses to work overtime. These bonuses are not enough. It is not sustainable for any person to work 16 hours a day, multiple days in a row, and to give effective patient care. There is safety in numbers. And when I say safety in numbers, I mean safety in the numbers of nurses. Increased nursing staff means better patient-to-nurse ratios, which means better patient care and better patient outcomes, and also safety for the nurses that are on the unit. When you go to the hospital and you are being cared for, you are more likely to be being cared for by a nurse that has not even been in the profession for 6 months. Running a unit as charge nurse without the proper training. As of right now, there is, I can guarantee you, a nurse that graduated in May that is now at work, short-staffed, being the charge nurse on a unit, putting her license on the line, putting our lives on the line, and putting our patients' lives on the line. You're giving us bonuses for work that we're doing. You are giving us pay for work that we are doing. Yet our CEOs are getting bonuses and turning around and telling us, we have no money to support you. If you are at million-dollar losses, why are you receiving bonuses? What are you being rewarded for? You are being rewarded for losing money, for not putting your money where it should be, in the safety of healthcare. Fairview was asked about metal detectors in our EDs. We were told nobody else has metal detectors. Why should we have them? There's not a problem. Less than 2 weeks after that conversation, our hospital was put on lockdown due to a gun scare, proving our point. We are not safe. The nurses are not safe. Our patients are not safe. We are here asking you to think about your loved ones. When you go to the hospital, when you take your children to the hospital, your spouse, your parents, who is caring for them? Are they burnt out? Do you want a nurse that is there that is so tired that they can barely think straight? Are you getting the correct medications, or are they giving you your roommates or the patient down the hall? Because we cannot think so straight. Our staffing ratios are so high that I have to remember what your needs are in addition to 5 or 6 other people? What medications are you taking? Do you ever remember when you have 10 plus medications to take? Can you list them off? I need to do that for multiple patients. And in the back of my head think, is this patient going to hit me? Less than a month ago, I was punched in the chest. I am still reeling for that. Do you know what happened? Let's go put you back in a room with that patient without any care to my safety or how I'm feeling mentally. How can I properly care for somebody when I am afraid of them? When I know that security is not there because Fairview is not providing security, even though we've asked, because that, in their words, is too rich of an ask. What is too rich of an ask? Is your health care, is your safety, is your livelihood too rich of an ask? 5 years ago, our patients weren't as sick as they are. They're not as violent as they are. Patients today that are in our med-surg units are patients that would have been and should have been in ICUs years ago. You are asking us to take on more patients, more work, with less staff, and to keep them safe. And this is what we are asking for, safety. We are asking for staffing. They go hand in hand. I cannot effectively care for you. I cannot keep you safe if I am not safe. I cannot care for you and keep you alive and keep you healthy if I am not healthy myself. I cannot come to work knowing that I just watched one of my coworkers get knocked out. We are suffering from PTSD. We have just gone through a pandemic. We have put our lives on the line. We risked the lives of our family coming home after taking care of highly contagious sick people in the middle of a pandemic where we are reusing paper masks. This mask that I am wearing today, our hospitals have told us at the time, in the height of a pandemic, please wear this mask 5, 6 days in a row. We do not have enough. We have asked them, please, can we have a stock of proper PPE in the event that this happens again? We know this is going to happen again. They do not understand that. They told us we cannot do that, and that is too rich of an ask. Where is our money going? Let's ask Fairview where that is going. We are not talking about you don't have money for wages. You don't have money to keep us safe while you continue to open new units with no staff to staff them, purchasing new hospitals, renovating buildings with no staff to staff them. But yet, it is too rich of an ask to keep my safety, the safety of those behind me, and the safety of the 15,000 nurses that have said we have had enough to keep us safe. Because without us, these hospitals are not going to run. Where are our bonuses? Where are our safety? And where is our security here? Thank you.
Glad you made it, Tracy. Yeah. So now you've heard why we took a strike vote. Like I said, we're forced to do this. And we've laid it out as clear as we can possibly, and I thank all these nurses behind me. At this point, do you guys have any questions?
I have a question. As far as yesterday, do you have the numbers for what the turnout was and how many people voted in favor of the strike?
As a rule, per board policy, we don't give out numbers. It was overwhelming at every hospital. It was not a question at every hospital, and that is what we hoped for.
Okay. And then how about the next steps here? I think that's the biggest question for all of us. I realize it's not an immediate strike. You need a 10-day notice for the hospitals, but what comes next now that you have this vote?
What comes next is all the negotiating team members will do our weekly get-together. We'll be meeting tonight for probably a 4-hour meeting that we will then discuss when and how long, because it's not an open-ended, I can tell you that, but that is what will be decided tonight.
When is the next time you're going to sit down with the other side?
I'm actually going off to Norris bargain. I'm going to bargain from 11 to 4 today. I'm going to be going to my hospital. We're going to do a half day. Do you all have days set up? Everybody's got days set up. Nothing stops. We keep, because we're hoping that this announcement, they'll watch the news today and think twice before they come to the table and say, we're not interested, or we don't have anything ready for the day. We hope to not hear that again.
What does the authorization send to them? What message does it send to them?
It should send to them. It should send to them that we are about to have 3 level 1 traumas across the state be out of commission. And I don't care how much they say, our hospitals will keep running just fine without all these nurses. We're going to have North Memorial, Children's Minneapolis, and don't forget St. Mary's Essentia in Duluth. This is going to be the first time in history that over 15,000 nurses in the private sector have all gone on strike together. The first time in history. And I'll tell you what, we are the voice right now in this nation. We are the voice of all the nurses all across the nation, because I don't care what state you go to. We're all in the same boat. Right now, we are heroines and heroes to every single nurse across this nation as they applaud us for standing together and working together to get 15,000 nurses all marching in the same direction. Do you know why? Because of what you heard yet behind us. We are forced to do this because our profession is at risk. When I can get on a news report and comment on a report that came out that 51% of the nurses across the nation will potentially leave the bedside as of next year, that is a public health crisis. Half of the nurses leaving the profession. So we are doing this to save our profession. We are doing this to save health care.
Mary, is it possible that some of the units could decide to strike and others could wait? Do you think this happen patchwork?
No, we're all together. We're not doing any of this. 2001, Fairview was out on their own. 2016, Alina was out on. No. Over my dead body. No, don't say that. But no. We will stick together like glue. Like I said, it's been hard, and it's been a challenge, and we've all, thrown occasional tantrums, etc. But we will stick together like glue, because that is our power, and more importantly, we have to stick together. This is a crisis. Right, guys? Right? Yeah. Thank you.
But you mentioned those prior years where patient safety and security were discussed, and in the end, a lot of times the line was drawn in the sand at preservation of pensions, health benefits, different things. Understandable.
Yep.
But, it raises the question of whether patient safety and security is going to get done this year, or whether that's going to be another thing you're going to have to sacrifice once you get the economic package you want.
We have 2 joint proposals right now, and when we say a joint proposal, that means we all have to agree, and we all can only move forward on one. One of them is wages, but that's always, the hospitals do joint wages. You're not going to have one Methodist making more than North Memorial right down the road. The other one is safe staffing. That's the other proposal. We're moving forward. I'm sorry, but that's not an option to just leave it by the wayside, to take the money and run kind of thing. That is not an option. We've described why it's not an option.
If you do decide to go on strike, and you leave your patients, you leave the bedside, what is your message to those patients?
First of all, we give a 10-day notice, okay? And we will continue to bargaining till the wee hours until the moment we have to go on strike, we will. So it's not like we're going to take them by surprise. And it would be very easy to say, oh, nurses, you're banning and stuff, but the public and our patients need to realize we are doing this for them. Okay? When we go on strike, we're not paid. Everybody's out, we have many people. That's why, people go, why is it taking so long? It's because we have had to, one nurse at a time, get so angry and so upset about their working conditions that they lose their fear of going on strike. That's not an easy decision. But our employers have continued week after week after week to ignore us. And like I always say, they're our best organizers. So no, we don't want to do this, and maybe I say one more thing about that topic. We are called to be caring for patients. To go on strike that's just one more moral injury that we have to hold in our hearts because we do it so unwillingly. We don't want to be so-called abandoning our patients, but we see our fight as fighting for our patients.
You've
had, obviously, 6 years ago, major disruption. What have you learned since then? What are you going to do differently? How are you going to approach this in a way that may not last that 37 days?
Oh, you mean when the Lina went out? Well, I alluded to that. Like I said, in 2001, Fairview was...
2016.
Right, I know. 2001, Fairview, 2 hospitals were left out on their own. That was 38 days or something. 2016, it was the Alina, the 5,000 nurses, all on their own for 7 weeks. 2010, we did a one-day strike. All 12 hospitals stayed together. It was done in 1 day. The moral of the story, and I've said this more times than I can count, is that we all stick together. And now we have the added benefit of the Duluth contracts were up in June 30th. So we now have another 2,500 nurses in northern Minnesota. And I want to point out that Duluth handles all of the Michigan Peninsula, all across northern Minnesota, all the way to North Dakota. They're like the safety net of the north. And now those 2 hospitals will be on strike. They have to think about that. This is a huge issue for all of Minnesota. Unless Rochester's going to handle it all down in southern Minnesota. We don't have any hospitals in southern Minnesota that are going to go on strike right now.
Are you hopeful?
I'll let you know after I go running back to my, bargaining today to see if it makes any difference. We all have sessions, right? We all have sessions. So we'll see. We'll see if they're going to continue in their obstinate behavior, if they're going to tell their lawyers to just sit down and be quiet and let us work a deal with the nurses. That would be nice. They're on this path of control that is going to be the demise of all of healthcare if they cannot let go of that attitude of wanting total control. That's what it basically is.
Any last questions? Thank you. Wait for it.
Yep. Okay, whose watch is this? Is that a recorder? You're kidding. How cool is